Okay, hello everybody. I'm going to give everybody just a minute before we get started, just so people can log in. So we'll get started here in a minute or two. Hang tight.
Recording in progress.
What is it? There we go. Oh no.
Oh no, it's echoing. I wonder if, is it because you have,
Oh,
oh, that's better. Yeah, that's great.
Okay.
That's great.
I just turned off my, oh no.
Oh, it's almost like when you lean away, Geri, it starts to echo.
You know. Oh, that's better. No, it's not.
Huh. We just did a practice run and it worked perfectly. So let me see. Geri, is it having two, because you have you're up and then your other voice is up, the other chat?
No. It's something that changed when we went live.
Yeah.
I don't know. All the speakers are muted.
Let me mute me for a second, just see
Yeah.
if that goes away really quick.
Try muting yourself.
I am mute. Oh, mute on here. Let's try that.
Okay. If I'm talking, does it have the echo? I don't think it does. Does that sound okay?
No, you're good, Ashley.
Okay, so it's something over there. Do you have any ideas, Amanda?
I don't. My idea was just the double, how she's logged in twice also.
Oh.
But one is muted, so I'm not sure.
Okay.
Thanks for hanging in there, everybody, with our technical difficulties.
We'll get going soon. I'm going to mute myself for a sec. Geri, you want to try?
Can you hear me now? No, it's
I don't know why
it's something on our end.
Yeah, is there a way to log off one of the computers, Geri? The other one that's up that doesn't have the
we're not
on
on two computers. We're on a Zoom room and a laptop.
Can
I
shut this?
Let's see. Oh, we got someone that's, so if she's logged on to two places, you might need to turn the volume completely off on one of the options. Thank you, Karen. We appreciate that. Hang tight, everybody. We'll get started soon. We'll get this figured out. Linda says it's working fine for her. So let's see.
Can you guys?
Yes,
hear
that
me
was
now?
good.
Yes.
Yes.
Yep. You gotta
Yes.
What sound?
Yeah.
Okay. Can you guys hear me? Yes. Okay.
Yeah. That's perfect. Good.
Okay.
Good.
Here.
Screen. Perfect. Okay. Well, I think that probably gave everybody enough time to log in too if you're joining us. So, Geri, I'm just going to do some introductions and then I'll let you get going if that works. Perfect. So, thank you guys for joining us today on this beautiful December day, at least here in Denver it is. I'm Ashley Ackley. I am a veterinarian in Denver, and I'm also a board member for the Gray Muzzle organization. And I'll be your host today. I'm not presenting, but we have a wonderful veterinarian who is, and I'll introduce Dr. Lake-Bakaar in a second. I'm guessing you guys are familiar with Gray Muzzle. We are the largest national nonprofit organization focused specifically on senior dog well-being. So we improve the lives of at-risk senior dogs by providing funding and resources to animal shelters and rescue groups nationwide. And just a few milestones that we have hit this year. Again, I'm sure a lot of you are aware of this because you're here for a gray muzzle webinar, but we awarded a record $848,000 in grants for 2023, so our most yet, and we have totaled almost $4.6 million since we were founded in 2008. So we gave out 90 grants this year. That's 15% over last year, 2022, which is great. And most importantly, we helped save and improve the lives of over 4,000 senior dogs. So, and I have to shout out, since both myself and Dr. Lake-Bakaar are based in Colorado, have to shout out to our fellow Coloradans. Yesterday was Colorado Gives Day, and we totaled over our goal, which was 13,000. So we raised $15,302, which is wonderful. So it's certainly not too late to give. We still have the rest of December left, but you're supporting senior pups by being here for these webinars and by spreading the word about gray muzzle and this new canine respiratory disease that is going around as well. So looking forward to hearing about that. I know we were going to talk about heart disease in senior dogs, but I think Dr. Lake-Bakaar asked if we could pivot, and I think it's really, really a great idea because we are seeing more cases. And I'm sure you've heard about it on the news, which I'm sure she'll get into. So just a quick note, if you have a question, if you want to type it in the question and answer box at the end of the presentation, I'll try to get to as many of those for Dr. Lake-Bakaar to answer as possible. And I'll let Dr. Lake-Bakaar introduce herself, but I don't think she's probably going to sum up everything. She's been a wonderful mentor and resource for her clients and for veterinarians in Denver, particularly with heart disease, which is what she specializes in. I'm sure she'll go into that. She even offered to see one of my own dogs on emergency after I adopted him with some heartworm disease. So she's a wonderful, wonderful veterinarian and person, and we're very, very happy to have her here. So with that, Dr. Lake-Bakaar, I will let you take it away.
Thank you very much. And thank you everyone for your patience with our technical difficulties. As Dr. Ackley mentioned, I am a veterinary cardiologist by trade, so I am not a respiratory specialist. Hearts are definitely my true love, but the lungs are sort of around the heart. And so I do quite a bit of respiratory disease as well by necessity. And then also I do own Evolution Veterinary Specialists in Lakewood. And so we're just getting so many questions on, just what's going on with this respiratory illness. We had a news station out here recently as well. So I just thought this would be a really good opportunity for everybody just to get the information out there that I know. And then again, I'm not a respiratory specialist, but we do have respiratory specialists here. So moving forward, just again, a quick plug for my hospital. We're one of the few privately owned veterinary emergency and specialty hospitals in the area. We do have a blood bank as well. And then we have a ton of specialties besides cardiology, which everybody knows is the most important. So my objectives of today is reviewing what we know so far about this respiratory illness. And you're going to see that I'm saying illness, not virus, because we do not know if it is a virus yet. So what do we know so far? What are the signs of this illness? And then most importantly, what should we be doing about it for our pets to help keep our pets healthy? Because I think that's everybody's greatest concern right now. So the canine infectious respiratory disease complex is a common disease, and so it's endemic. So it's out there in the population, and it's something that commonly infects dogs, and it's from the dawn of time has been causing issues in dogs. And so it's spread by respiratory droplets, and that's both viruses and bacteria. And it's going to commonly happen in animals that are in high density settings. So by high density, I mean shelters, boarding facilities, places where there are a lot of dogs, a lot of new dogs coming in close proximity. And then the treatment is going to be based on the severity of signs. So I actually just adopted a puppy a couple months ago from a high volume shelter, and he had these respiratory signs. And you actually don't treat them when they're mild. And then when the signs get a little bit worse, potentially antibiotics, maybe going up to steroids. But the vast majority of illness is, especially if the pup is vaccinated against respiratory illness, is mild. And that's also going to be applicable for whatever this respiratory illness is, which for right now, I'm still going to call the canine infectious respiratory disease complex, because all the experts are still saying this is probably a variation on that, not some new thing out there that's infecting dogs. So what are the signs that we're going to see with this? So the signs are going to be similar to any of the other respiratory diseases we've seen in dogs. So coughing, sneezing, nasal and or eye discharge, and lethargy. Sick dogs, and so we'll talk about what a sick dog is versus a mildly impacted dog later, may benefit from being tested with a PCR test that runs a whole gamut of respiratory causative agents that have been detected, both viral and bacterial. So again, this CIRDC is endemic, meaning that it is in the population, has been in the population for a while. And I think everybody's familiar with that term, especially with all of our issues with COVID, and it went from a pandemic and now is considered endemic. There are at least a dozen known causes. Most commonly known are probably going to be the canine parainfluenza virus and Bordetella bronchoseptica, which is the cause of kennel cough. There's also respiratory coronavirus, pneumovirus, influenza virus. So there's lots of different known causes out there. So what about this new respiratory illness that's out there? So it's less likely that there's a new pathogen that has mutated like the COVID, like happened with COVID. That's very uncommon. And it's much more likely either an existing pathogen that has changed, or it's also that our change in how we were functioning during COVID has actually now opened up the gates for an old pathogen to be more of an issue. There is a laboratory in New Hampshire that has also potentially identified a new small bacterium, one that may be resistant to antibiotic, but there's still a lot of plus minus about that. So I'm mentioning it here because you're probably going to hear about it in the news, but this is not something that's a definitive yet. So what do we know so far? So there are reports of this atypical respiratory illness that have been coming out kind of in 2023 or so. The Oregon Department of Agriculture reports about 200 cases thus far since August 2023. And so far, most of these dogs have a history of being with other dogs, either through a boarding facility, a doggy daycare, dog park, groomer, that type of thing. It's actually kind of interesting to note that we're not seeing this spread aggressively through shelters and through high density areas, which typically we would expect to see if we were looking at something that's a brand new novel infectious agent. So in terms of reporting, so this actually comes from Trupanion. So it's a little bit skewed in that it has to do with people who have Trupanion insurance and are putting in claims. But these are the Trupanion respiratory claims over the past couple of months. And so we are seeing some hotspots. So some of those in Canada, and then some hotspots obviously here in Colorado, in Oregon, in California, and then in the New England area as well. So again, I'm kind of reiterating these because these are the things that people are going to be most commonly worried about. The symptoms are going to be coughing, sneezing, difficulty breathing, eye discharge, nasal discharge, and lethargy. There appear to be 3 different camps of illness. And so there's the most common, which is going to be a mild illness. So just some mild coughing, mild respiratory signs. What's different about this illness compared to your typical illness is that it seems like it's lasting a lot longer. So it's sticking around for 6 to 8 weeks or longer, which for our typical respiratory diseases are usually self-limiting in a couple of weeks. Also, this disease process is minimally responsive to our standard therapies that we're using, so antibiotics, steroids, and airway dilators. And so that's really what I think the vast majority of our veterinarians are seeing. We are seeing, especially in our ER, though, these patients that are progressing to a chronic pneumonia. So these are dogs that are showing radiographic changes, some blood work changes, and they're not responding to antibiotics like our typical pneumonia cases are. And then rarely, and we are seeing these, and we are seeing an uptick in them, but this is not every patient that's in our ER, but we are seeing some really severe cases that are very rapidly progressive. They're progressing to an acute pneumonia, and they're requiring aggressive hospitalization. We've had 1 or 2 patients, at least in our hospital, that had developed a necrotizing pneumonia as well. So that's where the infection is so bad that it's impacting the lung to the point that it needs to be removed. But I do want to reiterate that the majority of dogs that are getting this new illness are recovering uneventfully. And so that's really important to remember, just because it is really scary when we hear that dogs are dying of this or dogs are being hospitalized. And those are still a very small proportion of the canine population. The majority are just getting this protracted cough that just does not want to go away. So talking a little bit more about respiratory distress, and this is the important part, because one of the important things is differentiating when we should be concerned to the point of taking our dogs to a veterinarian versus when we can give it some time. If we're seeing signs of respiratory distress, these are things that we don't want to sit on, and these are things that we want to get seen right away because our dog may need oxygen therapy or more aggressive interventions. So signs of respiratory distress are going to include persistently elevated respiratory rate or effort. And now that's not a respiratory rate or effort that comes and then suddenly goes away. I see this a lot with my clients, that their pet will be breathing or they were running around after a squirrel and then they're worried that their respiratory rate is elevated. As long as it's not persistent and it goes back down within the course of a couple of minutes or so, then I'm not worried about it. Another big concern is if they're open mouth breathing. Now, again, differentiating this from just a dog that's panting because he or she's nervous or something like that, versus their open mouth breathing because they're just desperately trying to get in air. Another thing that you can see is that their mouth is closed, but they're puffing out their cheeks when they're breathing. And this is something more commonly we'll see with a dog that's in distress. Another big thing that we'll see is what's called orthopnea, where they're stretching up their chin, they're stretching out their neck like this because they're just trying to open up that airway to get as much oxygen in as possible. That's never going to be a normal sign, and that's going to be a concern for respiratory distress as well. Restlessness or unable to lay down. So again, restlessness can be a cause of a sign of a lot of things, but if you're having a hard time breathing, the last thing these guys are going to want to do is lay on their side or lay on their back, and they just can't settle. So they're up and down and just not resting or getting sleep. So in terms of precautions, so in general, again, reiterating to everybody, we should be aware this is an issue. We should stay current in what we're learning, but do not be alarmed. The current number of reported cases are still relatively small compared to our general dog population. And I mean, we're doing it too in our ER where we are seeing more cases. And so the knee-jerk reaction is to say, oh my goodness, this is really bad. This is happening to all dogs out there. But considering how many dogs that are in our regular population, and we'll talk about that a little bit more too, is how COVID has changed that, the cases are still relatively small. So what do we do as dog owners in terms of taking precautions? So the number one recommendation that's out there is that vaccinations should be kept up to date as recommended by your veterinarian. On top of that, we should take special consideration to the respiratory vaccines we have available. So that's going to be our Kennecough or Bordetella vaccine, as well as our canine influenza vaccine. In terms of Bordetella, the intranasal vaccine is going to be best and oral second best. And in general, we're trying to use those over injectable vaccines. Intranasal is best. However, convincing our pups that intranasal is best can be a little bit more difficult. So for the more feisty pups, for the more fractious pups, oral is going to be a much safer option. They really don't like when we're shoving this fluid into their nose. They sneeze it everywhere. And so that's why, in general, we're still using that oral vaccine. But if your pup is really chill and able to take it, an intranasal vaccine is going to provide a little bit better mucosal immunity. The canine influenza vaccine was on back order for a while, but I know from personal experience, we were able to order some for our team. So it does feel like it's readily available again. So this is going to be another vaccine that's recommended. This is a vaccine that is a 2-vaccine series. So it's also extremely important that you follow up for that second vaccine as well and not just get the first one, because you do not get sufficient immunity just from doing the single vaccine. In terms of other changes that we can make, we really want to avoid communal areas. So communal water bowls and communal toys should be avoided. Avoiding playdates with unknown dogs. So these are going to be dogs that we don't know if they're vaccinated. We don't know what their health history is. And so those are going to be the ones we avoid. That said, socialization is still extremely important. So it still is okay to have playdates and to interact with vaccinated dogs and dogs that aren't showing signs, but being really cautious about what dogs, we are letting our dogs interact with. Also avoiding and limiting exposure to unknown dogs at off-leash dog parks, those types of areas, and also a dog that's showing signs of nasal discharge from the eyes, or coughing. And if your dog's showing signs, do a favor for everybody else and keep them at home and contact your veterinarian about what to do next. In terms of precaution for high-risk dogs, vaccination recommendations are really going to be somewhat mandatory in that these guys are going to be much more at risk of developing complications from respiratory issues, and we really should be vaccinating them even if they're not going to dog parks. And I would be much more careful about limiting their exposure as well. So we'll talk a little bit about what's okay and what's not okay for our pups, but for our high-risk dogs, we really want to keep them away from any chance of getting sick as much as possible, because we're worried that if they do get sick, they're much more likely to develop a worse sickness than a dog that's not high risk. So in terms of what do I mean by high risk, I'm talking about dogs that are older. So our older pups are much more likely to have what we call comorbidities or other diseases. And then they also just are more at risk, kind of the same as we were seeing in humans with COVID, of getting sick. Very young dogs, kind of for similar reasons. So these pups are not having a fully developed immune system yet. They may not have had their full set of vaccines yet. And so they're going to be at risk as well. Immunocompromised pups, so those are pups that are being treated for cancer, cardiac patients, any patient that has a pretty significant underlying disease issue is going to be at higher risk, as well as dogs that have underlying respiratory disease because their baseline is already abnormal. So their ability to tolerate getting sicker is going to be much harder. And then our brachycephalic breeds. So these are going to be our smushy face breeds like our boxers, our pugs, our French bulldogs. Their breathing system is not normal to start with. And so they're going to be much higher risk for developing respiratory diseases. An important point to note too that may be impacting why we're seeing more disease is that the popularity of these dogs has skyrocketed in the past couple of years. And so now we have a lot more high-risk dogs out there. And so part of this could just be that we're seeing more dogs that are more predisposed to having problems and more predisposed to getting sick from respiratory illnesses. So when should you go to your veterinarian? So again, to reiterate, don't take every single pet that's showing respiratory signs to the vet. That's important for a couple of reasons. So one is this is infectious. So if you're taking your dog that only has mild signs into your veterinarian, that's going to be impacting the veterinary population as well. And we really don't want that. Also, just in terms of availability of veterinarians, taking up veterinary appointments when this may be something self-limited is going to be important because then we can't get in those dogs that are showing illness. So the dogs that should be getting to the veterinarian, and you can always call your veterinarian, you can always call our hospital if you're not sure whether or not to go, is if your pet is really sick, if they're getting sick really quickly and their signs are deteriorating quickly, if they haven't been getting better over several days, or if there are complications, so they're not eating, they're vomiting, they're having diarrhea, or if there's a possibility of other disease, or if they're a high-risk patient. And so what do I mean by really sick? So really sick is partly you knowing your dog better than anybody else. And if you're really worried, even if it is mild signs, if you're really worried about your pet, I'm always going to say get them seen. Just make sure you tell your veterinarian that they are showing respiratory signs so that they can prepare you either coming into a different entrance or put you in an infectious room. That's what we're going to do if your pet comes in through here. We actually have a side entrance so you're going straight into a room rather than going through the general waiting room. But if your pet pet's showing weakness, severe lethargy, just doesn't want to get up, they're not eating or drinking, they're having difficulty breathing, their illness is worsening rapidly, or they're having such a severe cough that they're either having severe respiratory distress or they're vomiting, those are also signs. And then again, if you have a high-risk patient that's showing signs, you're going to want to get them seen sooner. Common testing and treatments that your vet's going to do is that if your pet is showing mild signs, their exam is normal, so they don't have a fever, their lungs sound good, they may just prescribe a cough suppressant and tell you, give it a little bit more time and see if they get better. If there's signs of pneumonia, so increased respiratory rate or effort, elevated temperature on examination, your vet's probably going to recommend doing some x-rays, doing some blood work, and based on how severe the signs are, doing some antibiotics. If they're not getting better from the pneumonia, those are the cases that tend to be getting referred to our internal medicine service, where then the internal medicine specialist may be recommending more intensive diagnostics, like getting a sample of the fluid that's in the lungs, potentially even going as far as doing a CT or a bronchoscopy. For those patients that are really sick, they're the ones that are going to require hospitalization, IV fluids, intensive care, and oxygen therapy. The mortality rate in these guys is where we are seeing patients dying, but even still with the really sick patients, we're seeing a 1 to 2% mortality rate. So when I talk about oxygen therapy, there's a couple options for oxygen therapy. So this is our ICU at Evolution. So we have quite a lot of Snyder cages. Part of that is my being a cardiologist and an owner. I really like Snyder, so I like buying them. And then also we do have a pretty high volume of cardiac cases. But we're going to see here what the oxygen kennels allow us to do is they allow the patient to still be in there. They can walk around, they can move around, but we're setting the oxygen level and the humidity. So these are going to be the majority of cases. As you see here too, we do have this patient set up with a infectious setup. So they're still in our main ICU because they're a critical patient. We do have a ICU isolation as well, but that's a little bit more set to the side. So we don't put our really critical patients in there. And then we have that line so that we're putting on gowns, we're taking precautions, we're washing hands for this patient. For those really severe cases requiring high flow, that's that little blue box that we're seeing to the right there. That is going to be put in through a nasal line. It does allow us to still provide really high amounts of oxygen. So for the vast majority of time, we don't have to escalate to putting them on a ventilator when we have our high flow. And we have multiple high flow units here, and we are having to use these for our severe cases. But these are ones where a lot of times when people hear about doing mechanical ventilation, they may be concerned about doing this. The high flow is a nice step up that we don't have to do a whole lot of intervention to get that high flow going, and it provides a little bit more oxygen for our more severely impaired patients. So what should you be looking for in terms of businesses? So I really want to stress that, especially if you have a puppy, especially if you're trying to socialize your dog, it's not reasonable, as long as they're not high risk, to keep them locked up in the house. And so really you're going to be wanting to look for dog-related businesses that are taking appropriate precautions to keep our pets safe. And so those are going to be businesses that are requiring up-to-date vaccinations, especially the Bordetella and the canine flu. And these are also businesses that are screening and don't allow dogs that are showing signs of illness. So those are dogs that are coughing, sneezing, eye discharge, lethargy, diarrhea. If they see this, they're asking the questions before they allow the dogs in the building. They're also doing a visual inspection to keep people honest. If they're not allowing those pets into, say, like a dog training class or something like that, that's a facility where I'd be more comfortable going. Also, there should be some steps that they're taking for infection control. So that's going to be not allowing communal dog bowls, and the bowls that are available should be getting cleaned frequently. And also ask them about what cleaning and disinfection protocols they're using. They should be using a commercial agent like Rescue or something like that. The standard agents like bleach, we are finding tend to be more caustic than beneficial. And so find out that what disinfection protocols they're doing. And then also a disinfection protocol is useless if they're doing it once a week. They should be doing it pretty regularly, and ideally after every round of dogs that are coming through. So if you have, say, a puppy training class, ideally they're mopping and cleaning after each one of those classes. Also ask about ventilation and air filters. Do they have any filters in their rooms? Are they filtering and trying to keep the air quality good? And then also, how many dogs at one time are they allowing? So a business could be doing all these things, but if they allow 100 dogs in, that's going to increase exposure, versus if it's small numbers of dogs, like 5 or 6 vaccinated dogs, and they're taking taking precautions, that's probably relatively low risk. And then also remember that we as humans can be fomites, making sure that we're washing our hands, sanitizing our hands, and trying to do a good job of not spreading things around. So again, I'm just going to mention this New Hampshire laboratory because that is in the news. Still a little bit of question mark in terms of, what they're actually finding, but they have been pulling samples since mid-2022 from Rhode Island, New Hampshire, Massachusetts, Oregon, and they're starting to pull some of the Colorado. And then even the senior pathologist at this lab is saying that the cases that are reported are not a large increase, and there also isn't a large increase in dogs dying from illness. So far, there was a little bit in the news, and I had a little bit of trouble sorting out. There was talk about a pathogen, a bacterial pathogen that doesn't have a cell wall, and that's why it wasn't able to be cured with antibiotics. However, I just recently went on to their most recent press release, and they actually said that they have not found any canine respiratory pathogens. So I'm not quite sure what's going on there. And I looked as early as recent as last night, but they are looking at DNA, RNA viruses, and bacteria, fungal cultures, and they're not finding a specific pathogen. And then for those interested, because everybody's worried about COVID, they are testing these samples for COVID, and they're all negative as well. So I'm taking most of my lead and most of my my information from Dr. Scott Weiss. So he was also a real forerunner during COVID, and I followed all of his protocols during COVID, and we actually never had an outbreak in our hospital. We were actually one of the last hospitals to go curbside. We were allowing pets in for quite some time, and we opened up. We were one of the first hospitals to open up. And following his protocols, we didn't have any outbreaks, and we didn't have any issues with our staff. So he is a veterinary internist, but he also is the head of the infectious disease and infectious control for Ontario Veterinary College. And he's also on a ton of different international committees as well. So this is a guy that knows his bugs and knows his infection control. So I'm going to defer to whatever he says. So he does have a website blog, which I got most of this information off of, called wormsandgermsblog.com. And it's really up to date. So I would refer anybody to this blog. It is written in a very readable way so that both veterinarians and lay people can understand what he's talking about. And so in his blog, most recently from the 1st of December, he talks a lot about why we're seeing this uptick. And so he multiple times said he really doesn't think this is a new pathogen. He's not particularly worried, and he thinks this is probably a variation on the endemic illness that we've been seeing. And he thinks that there are some other reasons why we're just seeing more cases now. So in terms of what this possibly could be, just kind of broadly speaking about we see new cases, what could be causing them, the options are going to be, is this a multi-state outbreak caused by a new bacterium or virus? Is it a multi-state outbreak caused by a more common agent and for some reason patients are more susceptible? Is it unconnected local outbreaks caused by different pathogens but common pathogens? Is it a slight increase in baseline disease, or is it a normal disease activity with an outbreak and it just is being heard in the media, so it's getting a lot of hype? And then the other big issue he talks about is we don't have a surveillance program for respiratory disease or for really any disease in veterinary medicine. And so a lot of these cases too are going to be impacted by, if we have a community that's more concerned about respiratory disease or more proactive with getting pets treated, we may be seeing more cases. And in areas where they either don't have ERs or people aren't as proactive with getting their patients care. So without having a surveillance program, we're just going with the data that we can collect, but that data may be skewed. So he did talk in a Trupanion forum that was recent, and the Trupanion forum, again, pulled all of their reports of cases, and that's where they got their data from. And so the head of CSU infectious disease did report, after pulling cases for the past few months this year compared to last year, that there has been a 50% increase in hospitalization for pneumonia over the past few months. So that does imply that we are seeing more dogs that are presenting with pneumonia, but doesn't necessarily mean that, again, this pathogen is worse. If we're seeing more cases, we're more likely to see more severe cases as well, just because of the sheer number of cases that are getting sick. So overall, the entire panel agreed it's likely more a normal CIRDC pathogen that's just happening in a higher rate. So again, that means our common agents that we talked about before are probably the underlying cause, and they're just infecting more animals. Again, we're seeing a typically mild disease with a small subset of them that are getting pneumonia, and even smaller subset that are becoming critical. And so given the higher rate, of cases that are getting sick, we're going to see a slightly more pneumonia and slightly more critical cases, again, because that number of cases getting sick is that much higher. So this is a graph that they provided of cases and claims over in US and Canada. And again, these are not all the cases that are happening in the US. These are just people that have been reporting claims to Trupanion. And we are seeing a slow uptick with time. And Dr. Weiss did talk about this, that basically over the past, since 2020 or so, he's been seeing an uptick in the number of respiratory cases. But as we can see here from this chart, there are ebbs and flows with a peak happening kind of in between June and September of 2021. Then it pops back down in March of 2022. And then it looks like we're kind of coming off of a low in March of 2023 that's coming back up again. In Colorado, we definitely are seeing an increased number of claims. So in 2023, we've seen 132 claims compared to quite fewer than that. So that does imply that there are more cases getting sick. Now, at the same time, now that this is in the news, more people are going to be taking their pets to the vet. So that's more patients that are going to be taking their patients to the vet and making claims about respiratory illness. So although this probably does reflect that we are seeing more cases, how much of this also is a reflection that we're more aware that there's a respiratory illness going around. So again, he talks about what changes in behavior would explain why if we have the same pathogens causing illness, why are we seeing more? So most of it we can actually blame on COVID, which I like to blame for pretty much everything that's frustrating. So he seemed to agree with me there. So we're seeing more dogs in general. So every veterinarian knows that COVID led to a boom in pet ownership. So everybody got dogs. So almost, I think it was something like there was a 7-time increase in pet ownership. All of the veterinarians were full, all of the ERs were full. And part of that is just that more people are getting dogs. Also during COVID, there was a disruption in veterinary care. So people couldn't get into their veterinarians either because they were closed due to outbreaks or just because there were so many appointments being made that not every dog may have gotten fully vaccinated. There also was a disruption in availability. So the flu vaccine wasn't available for a while, so people weren't able to give the flu vaccine to their dogs. Also, as humans, we've changed the way that we function when we were during COVID and even potentially post-COVID, where more people are working remotely. So that means less dogs are going to daycare. And for most people, they're not going to get their dog vaccinated for kennel cough unless they have to go to a daycare. So fewer dogs vaccinated overall. And then also fewer dogs interacting with each other. So they get these low-level respiratory illnesses that go away. And we're also seeing this in humans as well, that we're seeing more respiratory illnesses because we just weren't exposed to each other. And now we're seeing more people getting sick. Also, there's other changes in human activities with how dogs interact. So more people are working from home, more people are taking their dogs out more. So more dogs are interacting as well. And then also there's change in the types of veterinary vaccines that we use. So could it be a change in the efficacy of the vaccine? And then again, kind of as I brought before, the earlier restriction, we weren't interacting normally. And so now we have a population of dogs with less exposure, which means less immunity. And so they may be just more prone to getting sick. Another question I want to answer, because I've been asked about this, is what about Paxlovid? Just because, with COVID, that's been getting used more in people. So Paxlovid is an antiviral. There's not something special about it with respiratory disease, but it does treat viral illness. The issue with it is that we first of all don't even know if this respiratory illness is a virus or not. And also we have absolutely no data on dosing, safety, or efficacy. So there were some studies done on dogs in terms of like plasma levels and that kind of thing, but we don't know what we should be giving dogs. And so overall, this is not something that's recommended. I think it's also important just not to forget that there are other more common causes of respiratory signs. So I'm getting a lot of reports from different veterinarians that, dogs are coming in that have, say, tracheal collapse, and they've been coughing for years, but now people are hearing on the news that there is this, new respiratory illness. They're coming in saying, could it be that? Likelihood if your dog has been having the same cough for years and years, that cough is still due to those causes. I'm also seeing even veterinarians getting worried about the respiratory illness. So we're missing more serious things like cardiac disease. So I've actually had several patients come in that were getting treated for this respiratory illness, so either antibiotics or that kind of thing, and they ended up having heart failure. So fear about the respiratory illness is causing delays in them getting the care they need for the more common things like heart failure, which is more common for me because, I'm a cardiologist. So in summary, I just want everybody to use caution, but not panic. So yes, this is something we need to pay attention to. I'm not saying ignore it, but make sure you stay educated in what the news is, and also just stay educated in terms of what the best things you can do for your pet. The best thing you can do right now is to get your pet vaccinated, and especially get them vaccinated for respiratory illness, and avoid contact with unvaccinated or sick dogs. And then if you do have an older dog or a high-risk dog, to take extra caution. So those are the pets where it does make sense to limit exposure, to get them vaccinated, and to avoid things like doggy daycares. We're likely experiencing an uptick in an endemic disease rather than a new outbreak that's something new that's going to go across the entire country and affect all of our dogs. So keeping that in mind is really important. And again, I'm saying likely, I'm saying probably, because we still don't have the data or the evidence to say definitively what's causing this. So it is really important to make sure that you're monitoring sources, and with an emphasis on reputable sources in terms of where you're getting your information from, because it could change, and we could find a novel virus, we could find novel bacteria, and that would negate a lot of the things I've said. But just based on the experience that we have so far with how illnesses work, that seems pretty unlikely. In terms of reputable resources, the places that I would recommend going to are going to be the Colorado Department of Agriculture. They've started a canine respiratory disease page, and here is the website for that. Also, Dr. Weiss's blog is a really great source of information, and he actually will typically react to other news stories as well. So that way, if there is something in the news like Paxlovid or something like that, he's going to be commenting on that. So that's a great place to get information as well. And then here at Evolution, I'm trying really hard with my team to stay on top of everything. And as soon as I have confirmation that that is the information that I should be putting out there, we're posting on our social media. So here are our social media accounts as well. Certainly you can reach out to us too. And especially if you're worried about your dog, if you're worried about your dog after hours, you can certainly reach out to us for more information. So with that, these are the references that I use. So if anybody wants to check up on these, I went through these references. These were the most reputable references that I could find. As you can see, I don't have many news articles in here. Every single news article that I read got their information from one of these sites, either the New Hampshire laboratory or the Colorado respiratory outbreak page. With that, I just wanted to plug a little bit more about our hospital. So we do have a blood bank that is volunteer led. So we do have a blood donor program. So if you think that your dog or you have a cat may be a donor for this, we would love to have you and screen you. The requirements are that your dog has to be less than 8 years old, and they can't be a baby. They have to be more than 50 pounds and in good health. They need to be friendly because we are getting blood from them, and they can't be on a raw diet just because of concerns with potential infection there. They can't be breeding dogs, and they can't have received a blood transfusion before, and they need to be up to date on vaccinations and preventatives. In terms of benefits, besides being able to help save lives, we do give a credit towards each donation. We do a free exam. If there's anything like a soft murmur we need to check out, I will do an echo on your dog for no charge. We do free blood work. We have a Kong-sponsored goodie bag. And then we also do offer 10% off of preventatives if you get them from us. So if you have any questions about that, please contact us and we can get you in touch with our blood donor program. Also a plug for our Zelda Fund. So our Zelda Fund is basically providing resources to shelter animals, and also for people that are looking for getting support for veterinary services. So we commonly will see people with like a urinary obstruction cat or a pyometra dog that really need to be able to get their pet taken care of, but just don't have the funds. So this fund is designed for that. I also recently started a rescue foundation. It's called the Twilight Bark Network, where we take pets from high volume rescue areas, shelter areas, and me and my doctors and technicians will foster them. We'll get them vaccinated, spayed and neutered, and then we find homes for them. And that's why I find myself with a puppy today, because I foster failed, but he's the best puppy in the world. So it was worth it. And my husband has finally forgiven me for that. And that then takes me to the end. So here is all of our contact information. Best way to reach all of our team is through our info. Then you can they'll forward you on to the appropriate resources. This is our phone number and location, and we'd be happy to see anybody if they have any questions, would like a tour or anything like that. And with that, I clicked the wrong button and I'm going to try to unshare. And I think Ashley was going to help me forward some questions.
Yeah, I have lots of questions. Thanks, Dr. Lake-Bakaar. Let's see here. Yeah, where to start? So we'll start here. We have a few. Does this pass from humans to dogs or vice versa? Do we know?
So that's a great question.
Good question.
And so far, there's no evidence that it's other than a canine host, so meaning that it's not zoonotic, so it can't be passed on to people. There's no evidence that it's coming from people, and then also there's no evidence that other dogs can pass it to dogs, but they're not passing it to like cats or other animals in the household, as far as we know.
That's great. Let's see here. So these are some questions. Oh, I think from one of my classmates actually. So she was asking about COVID. The ones that tested for COVID, do we know when they were getting tested? Because some of the samples on average, they test positive for 3.8 days, she said, from samples. Yeah. So if we're testing later, then how are we knowing how many false positives or false negatives we're getting?
Yeah, and that's an excellent question. And that's actually part of my hesitation with the New Hampshire lab, is that the timeframes that the testing is being done is not standardized. So as your classmate was pointing out, if we're doing these tests, we really need to be doing them within 72 hours of them showing signs. And so one, there's not great documentation of when they first showed signs. Two, we're not really sure exactly the timeframe of when it's being submitted to being tested. So they're just testing the samples, but there isn't a great record that I could find, at least, that these are samples that were tested for COVID within that 72-hour window that she was mentioning.
Got it. Thank you. Let's see, can a dog be asymptomatic and infect another dog? Or like people can be asymptomatic for COVID and pass it on to others?
As far as we know, unlikely so far. So that's kind of based on the information we know about the canine infectious disease process. But essentially, it's passed in droplets. And so far, we believe it's going to be a sick dog that gives it to another dog. And this actually, so I went to see Anthony Fauci speak a couple weeks ago, and he was actually saying that this was one of the properties of COVID that really threw them for a loop, because initially they assumed with most respiratory viruses, you're sick when you're shedding the virus at the highest amounts. And so they assumed that initially, and then they kind of realized, oh my goodness, also asymptomatic people can make you sick. And so that was kind of something unique to COVID that made it such an issue. But in general, respiratory diseases are going to be passed on by symptomatic animals.
Right. Are cats coming down with this too? Is this strictly dog related right now?
Yeah, so far there's no reports of cats, and again, that's where keeping an eye on the resources, because potentially that could change. But as far as all the data I have, everything that I scoured on the internet, there's no feline reports that have been definitively linked to this. So we do believe it's a dog-only issue.
Let's see here. Are there any alternative medicine approaches to consider?
Definitely. And so especially for mild disease, there's really no evidence that just waiting it out isn't an issue. So as long as they're not getting worse, kind of waiting out the process. Certainly two alternatives are possible, especially for the mild disease, is very reasonable, especially if they're working. For the other disease process where they're getting more sick, that's the part where we're still trying to figure out what's going to work for these guys. And that's where it does get a little bit scarier, is we've got these really sick pups in our hospital. They're not responding to the standard antimicrobial treatments. And that's when we start to get more concerned and more worried. But for mild diseases, alternative, as long as you're working with your veterinarian, alternative therapies should be totally reasonable, especially if your pup's not getting worse.
Right. And then let's see here. Is there any data on areas of the country where vaccine compliance is higher or lower?
And that's an awesome question, and no. And that's one of the big issues that Dr. Weiss was talking about, is that we just have to take the data as we have it. And so the only data that I'm aware of that's kind of nationwide is this Trupanion data. And then that is a very skewed population. And then we can't really tell, who's vaccinated and who's not. When they're pulling the data too, I'm sure someone could dig into those claims and see like if those dogs, taking out the numbers they have, and like which of them are vaccinated versus which are not, and potentially after that forum they may dig into that. But that's an excellent question. And also in terms of vaccinating them, we don't know for sure whether vaccinating is going to help dogs, but it just seems like, if we're vaccinating at least for the common respiratory illnesses that we have vaccines for, it'll at least decrease risk, but we don't know that for sure.
Okay. Great. Do you have time for a few more, Jay?
Sure. Yeah.
Okay. So this kind of goes along with that, I think. Do the figures that you were talking about categorize brachycephalic versus non-brachycephalic dogs? So squish face.
Right. So they don't, but one point to make, and they brought this up in the forum, is that ownership of brachycephalic dogs, especially like Frenchies and pugs, has skyrocketed in the past couple of years. So potentially part of this, and they actually didn't pull out the breeds, and I'm wondering again with the forum if they're going to do this, but part of the uptick that we're seeing could just be that we have way more brachycephalic dogs who are just going to be way more prone to getting sicker with respiratory diseases. That it could be partly that, but we don't have that data.
That's great. These are wonderful questions, by the way,
really
you guys. Yeah, I think we talked about the asymptomatic dog. This is another, I guess, another one about COVID. So with COVID in people, they recommended doing serial testing in order to trust and negative. Should we consider that in our dogs and pool samples over a period of days?
Yeah, I don't think it's unreasonable. And they kind of talked about this a little bit in the forum as well. And the link to the forum too, anybody has access to it. So if anyone's interested in like seeing it for themselves versus my paraphrasing, it's open to the general public. I'll go back to, let's see. I don't know if can I go back to that page? So you guys have it. So yeah, so this is the link here, and so you can go to that and it's open to everybody. But there's no evidence that it's COVID based, and so would it be wrong to do serial testing? No, but it's kind of who's going to pay for that. So we don't have great data to show that it is due to COVID. It would be great if you have a lab that wants to do COVID testing and would take the samples, but it's kind of that cost benefit. Right now, the cost benefit of doing it is not there, but certainly, again, we don't know exactly what's causing it. We're relatively sure it's not COVID, but could it be a COVID variant? Who knows? Less likely based on everything I talked about, but certainly if you have the ability to do serial testing and a client that's motivated, it wouldn't be unreasonable.
Yeah, just to add to that, I think in being in general practice, where I am kind of the first line and seeing a lot of these cases, a lot of times we don't have the resources to do any testing. And so I think that's what we find with the majority of dogs out there probably never get tested for this. And we're just kind of, treating it the way that we always have. And so it's really now I think people are starting to do more testing, and hopefully it'll be easier because people want to know. But I think it's been really hard up to this point to have an owner spend. I think our respiratory panel is like $300 something. So yeah, but that's a great question. So this is a good one. Is there any data tracking if some dogs are on immunosuppressive drugs like atypical or high dose steroids?
That's an awesome question. And again, no, I think these are all great questions that I'm hoping that there's a number cruncher at Trupanion, because that seems like that's where our biggest data set is right now, that could pull that data for us. But certainly, yeah, I mean, that's another question, right? Is all of these new medications out there that are available. I mean, like my dogs are all on Apoquel, like, and so could it be that there's a medication out there that's predisposing animals? And that's kind of what I talked about in terms of, has something changed with our behaviors it's predisposing dogs to pathogens that are already out there. There's no data to support that, but that possibly could be a cause too.
Yeah. And then I have two. MHDL, you have been amazing with the questions. I was trying to kind of clarify this one because there was a question about what about acceptance of titers for some of these respiratory things, but I think you were asking about titers in general. You said when my late dog got a Bordetella shot, the vet that gave it was sort of dismissive about its effects. So how well do those vaccines even work? Yeah.
So we're digging back to veterinary school, which was like many eons ago. But I do know, at least for the Bordetella, it's IgA, I believe, that's like your mucosal immunity, and that's actually the reason why the intranasal vaccine is recommended over the oral and over the injectable overall, is because you're trying to get that IgA that's in your mucosa. And so IgA is like one of those like more finicky immunoglobulins, so it like doesn't last very long. So that's why that vaccine needs to be repeated so frequently. So I don't know what to say for the flu vaccine, but I know for sure with the Bordetella, you're going to just have, unfortunately, to repeat it because you're needing that mucosal immunity. But again, if you have a dog that's like having horrible complications, then maybe that's a dog you don't do, but then you have to be extra, extra careful and not let them out and that kind of thing.
Right. And as far as I'm aware, there's no such thing as doing Bordetella titers or flu titers for dogs. And we know that even though maybe we don't think that these are the two diseases or the two pathogens causing this, anything that we can do to help the respiratory system and protect them as best we can is going to be what's important. So it's one thing to go, oh my gosh, why does my dog have to get a flu vaccine if we don't think this is the flu? But again, anything we can do to kind of help them with their respiratory tracts and keep them healthy, I think is a good thing to do. And obviously talk to your vet about it. One last question that has to do with the blood donor blood bank, but they said, do you only operate in Colorado?
So that's a great question. So I guess in terms of blood donors, we only do it in Colorado because we do all of the acquisition in our hospital. If it's a clinic that's trying to get blood from us, I can put you in touch with Julie, who runs our blood bank. And there are some limitations with like shipping, blood across state lines, but it is something that we have done. So if you're a clinic trying to get blood, one of the goals of the blood donor program was to really be able to get blood to as many animals as needed, rather than just our in-house use or just a few hospitals. So certainly if you're looking to get blood, another hospital, I can put you in touch with our czar of blood, who is Julie Batatas.
I was gonna say, or you guys are all just gonna have to move to Colorado with us. Someone asked if you'd open an evolution practice in Michigan. So
don't say it to my husband because he's always the one that wants to expand, and I'm like, I'm good.
Oh well, I'm lucky to have you in Colorado, and we so appreciate you doing this talk for us. Hopefully you guys learned some things about what's going on, and it helps clarify all of the information you're getting out there, because I even see on the news I'm getting inundated with all of this. So hopefully this helps and you can pass it on. And yeah, Gray Muzzle, thanks you so much, and thanks everybody for being here. So I think we'll send off. Do you have anything else, Geri?
Nope, I'm good. Thanks
Right.
Everyone for again being patient with the technical. So bye everyone.
Yeah, thank you. Take care.